A doctor who qualified summa cum laude has written today of how she's been left without a job despite what government claims is a shortage of doctors. Dr Sunhira Sugdeo has written in the Daily Maverick about how she cannot get work and government departments have not employed her. Dr Mvuyisi Mzukwa is the chair of the SA Medical Association. Dr Mzukwa, good afternoon to you. We keep being told we have a shortage of doctors, and yet here is a doctor sitting at home. I presume she's not the only one. Are there many doctors who are qualified but not working?
Good afternoon to you, Steve, and to your viewers, and thanks for inviting me. Steve, this is a serious problem and a deep concern from the South African Medical Association that we can have such a high number of medical practitioners who are qualified, well qualified, who are sitting at home with skills, whilst actually we're running short of such doctors in the country. We already know that we've got high numbers because we've been compiling a list of such doctors so that, when we talk to government, we can produce, a list of people they can see. So this is what the South Africa is facing at the moment.
How does this happen? I mean, how is it that we have a shortage of doctors and yet we have so many doctors who can't get a job? Our government has a doctor's shortage, don't they?
Well, Steve, the shortage of doctors is a complex issue caused by many factors. You will understand that, in this country we've got a problem of poor planning or lack of planning. We also have a problem of communication, but also budgetary constraints. You would have noted that we've been suffering from, poor budgeting in terms of having those a decrease in the budget in the Department of Health. But what surprises us, Steve, is that whilst we are heading for a NHI, we see that there is no bailout for the Department of Health. I mean, we've built useless companies like SAA and many others, who are poorly performing. But when it comes to healthcare, we don't see that a robust approach by government to say that we cannot have a healthcare suffer like that, where you've got, the imbalances, especially of distribution of healthcare professionals, most of them concentrated in the urban areas, and you find those underserved rural areas that don't have enough of those practitioners. And yet you have practitioners who are sitting at home, who are qualified, Steve, who've been funded by taxpayers. Instead, they are looking at other options, and some of those options are that they want to go abroad or go to the private sector. Do you want to tell me that we are using taxpayers' money to actually train for other countries?
I mean, the whole thing is madness. And I mean, every year, Dr. Mzukwa, for the last few years, you and I have had to discuss the fact that people who have graduated, who need to do their community service, are allocated their positions very late, if at all. Is that also because of bad planning?
Yes, it is because of bad planning. I mean, look at the information that we have at the universities. We have very few universities in South Africa compared to other countries, so it shouldn't be a big problem to allocate those in such a way that we even get advised that someone can do that work for them, allocating interns and community service if they can't. But we pin it down to that, to poor planning. You recall that, Steve, these people have been taking, especially provinces, taking students to other countries like Russia and stuff like that, only to dump them there because they don't have enough funding. There's been this fragmentation of planning by this government, and I don't think that it is a very attractive issue if you look at us going towards the NHI. We think that, people are looking for a universal health coverage. They will make sure that they have enough numbers on the ground. They have enough doctors on the ground, nurses on the ground, but that's not the case. You know that the statistics are 0.3%, 0.3 per thousand. in the public sector, and 1.75 in the private sector per thousand. So there's a dire shortage. I mean, if you compare that to what the World Health Organization is recommending of 1:1,000 patients. So I do think that there's a lot of work that needs to be done in terms of enough budget. You know, Treasury must assist the Department of Health, but not only that, they must monitor how the funds are being used in the Department of Health.
Dr Mvuyisi Mzukwa, thank you, Chair of the SA Medical Association. Really do appreciate the time.